Welcome to the MD Edge Post Call Podcast, a special holiday edition. Other shows around MD Edge are doing year in review episodes and giving you the best of content. But the Post Call Podcast is so new, we didn't think we would do that. Instead, this episode is going to be an In Case You Missed It episode. Our very first edition was a conversation between myself and Dr. Lorenzo Norris at his office in Washington, D.C. Dr. Norris is, of course, the host of the MD Edge Psychcast and is the editor-in-chief of MD Edge Psychiatry. You can find more on him and the MD Edge Psychcast by clicking links in the podcast description. Thanks so much for joining us. We'll have another special edition next week for your holiday season, and we will come back with new content in 2019. Here now, my conversation published earlier this year with Dr. Lorenzo Norris.
If medicine turns into a business, if medicine just strictly becomes another consumable good, well, then then you're going to start to question it. Then you're just kind of like, well, you know what? If I'm selling something or if I'm just doing strictly a customer service type of thing, then why did I even get into this? Why did I take an oath?
Welcome to the MD Edge Post Call Podcast. I'm your host and producer, Nick Andrews. At MD Edge, we know that medicine can be a bit of an awakening at every step of your career, from med school to residency to fellowship and on to practice. So this podcast is all about sharing your stories, what you love in medicine, and what you love outside of your career. Here, we want to draw on the things you love and help you find your truth. In this, our inaugural edition, I welcome the host of the MD Edge Psychcast, Dr. Lorenzo Norris. Dr. Norris is a dean at the George Washington School of Medicine and Public Health, as well as editor-in-chief of MD Edge Psychiatry. He and I spoke only days removed of the suicides of designer Kate Spade and writer-chef Anthony Bourdain and the murder of musician XXXTentacion in the summer of 2018. We chop it up about those tragedies, as well as how to find truth in music and what can keep you going when you're feeling burnt out. I bring you now to Dr. Norris's 6th floor office on a cloudy day in the summer of 2018.
It's been interesting.
Yeah, what do you think so far?
You know what I think
Is
so
it for
far?
you?
Yeah, it's real. It's cool. It's fun. But the interesting thing about it is, and you and I have talked about this, a lot of the best stuff is when we're not actually recording.
Yeah.
That's the thing that, that's the thing that sucks. And I always tell people, I'm like, look, dude, wait, save it. Don't use it all right now. But it's a lot of times it's the prep. And then people are kind of saying, well, I got to be careful about what I say or how I do it and this, that, or the other. And I'm like, no.
Don't worry about it.
Don't worry about it. We want to put some stuff out there that's going to get people to think. But yeah, it's been pretty interesting. I mean, as you know, I'm not some podcaster or audio guy or whatever, but we've had great guests. We've had folks that have been really passionate about what they've talked about. So it's been cool, man.
I think the first one was Dr. Nasrallah, and I'll admit I call myself in medicine a muggle. I'm a muggle. Okay. I'm not a doctor. Okay. But I learned a lot about schizophrenia that I didn't know. And I was like, oh, that's the craziest stuff I've ever heard. I thought it was just sort of like a behavioral thing. It's like, no, there are storms. It's like cancer. There are stages. So it was really informative to me as a layperson. But I also found that there are little tips and tricks in there about how to make practice better for clinicians. There's also like a lot of information in the early ones. I forget the woman. She was a recipient of an APA award, a book award. Yeah, and there's a lot of stuff in like how to do your own like personal well-being, and now we've added Dr. RK at the end, who's like tips and tricks like taking your patient's weight. Yeah, that's an interesting thing, and so I think that the podcast is growing, and we're happy to have you, man. It's getting better and better every time. I love it.
Well, cool, and I'm glad people are hopefully picking up on those tips and tricks. I mean, because it's one thing. Look, it's one thing about to take the science. It's another thing in terms of how you translate that into your actual practice. I mean, you and I have like kind of riffed about athletics and things of that nature.
Yeah,
before.
We will. We'll get into that.
Yeah, but it's kind of, I think about, all right, you got the coaching, you got the playbook, but that's different than actually running the play in real time when when things are on the line. So that's kind of what those tips and tricks are about.
Yeah, no, which is I think something that's like it's a dirty little secret of medical school and of the residency. And you get in residency, you're like, wow, this is not what medical school was. And then you get into practice, you're like, this is not what residency was. Uh-oh. And like, what do I do? And everyone's like, well, I don't know.
And you know something? That's one of the biggest challenges in terms of predicting what type of physician somebody's going to be because you're constantly going to a different stage or level where things aren't the same. I mean, you can actually say that, okay, this person is prepared to enter that stage. But I was just telling medical students, this time of year, right now, June, July, every hospital, academic hospital, you're going to have a bevy of new interns. Yeah. And once that responsibility hits your butt, it's completely different. And the best you can do is hope that you've been trained adequately, but none of us can really predict how anyone's going to respond to that.
It reminds me of like a military, like a training video where you see the guy's scared to jump and the commander's like, well, I'm kicking you out.
Yeah.
Pull the parachute, man.
Yeah, absolutely.
I know that right now in the hospitals, there are a lot of people that are getting the rude awakening about how difficult it is. But that rude awakening has been well documented. People know about that one. The one that I am slowly starting to learn about is the one where you get out of the residency or your fellowship and you're no longer in the big, sexy, beautiful hospital with all the money. You are in rural America and there's no support.
Welcome to the real world, baby. Yeah. Welcome to the real world.
Yeah, now there's like billing and Epic and a bunch of stuff.
Well, you know something? That's why when you think about, as far as I'm concerned, the development of a physician, and there's been a bit more of a movement towards this, realizing this in, like, whether it's through the AAMC, that UME, undergraduate medical education, GME, graduate medical education, and I would dare go as far as to say the first 2 to 3 years when you are out of fellowship or residency, those are all periods of critical because you're dealing with people's lives, but those in particular are critical periods. I'm thinking about a resident of ours who graduated, and I remember her calling me, and she was practicing rural psychiatry. Where was she at? Maybe Wisconsin or something of that nature. She was only psychiatrist in 100 miles. That's
insane, man.
Yeah, and she was doing all types of stuff that was amazing that we hadn't trained her to do because she had to do it. Yep. And, and so again, there's that practicing in a rural setting. There's her practicing in a bit more isolated setting when you are, I won't say isolate, but where you don't have all the bells and whistles and administrative staff. And guess what? Yeah, you got to do your own billing. You got to do your own EMR. You got to set up your own appointments. And depending on who you are and what you want to do, you probably are going to want to practice in those settings because you might have a greater sense of autonomy and it might speak to your mission a little bit better.
I think that's a conversation I have with some people in my personal life, some of my friends. I got some interventional radiology fellow friends, and I got a couple surgical resident friends, and they are constantly juxtaposed between, man, I pursue academia with the cool cases and I would love to teach, versus, wow, if I was a surgeon in Alaska, I would get to do real help to real patients. I would do things that help them, and I could take control of a community and give them hopefully better care than they have now. And that's a real aggressive fight to have in your head for 5 years. Like, what course do I want to pursue?
It's a huge fight because, I mean, you look at that, you hit the nail right on the head with autonomy. All right, and doing what you feel so you were meant to do in terms of purpose, which point blank, that's probably one of the best protective factors against burnout, in my humble opinion. And then this call towards academia, and if you will, because let's face it, academics are still academics in terms of scholarship, teaching, research, and things of that nature. And then there's another big pressing factor, and that is debt.
Yeah.
All right. A lot of people come out with a lot of debt, and regardless of how grand your mission is or whatever, one of the first things I learned as you start to work up, no money, no mission. Yeah. So if you can't pay your bills, if you can't support your family, I don't care how great the mission is or what you're doing, eventually the rubber's going to hit the road. So people got some tough choices, man.
Yeah, absolutely. And that's when you start to think about like how to appropriately bill a procedure, or like how long you can see a patient for this portion of Medicare and Medicaid to kick in, and that's when I feel like physician burnout in those first 3 years post fellowship or post residency. It really starts, people get punched in the face a little bit because they're like, man, I'm only working with patients and doing medicine like 10-20% of the time. Everything else is logistical business work.
Oh, I can tell you from faculty that come here, and I'm sure it's the same at academic centers, they get more than punched. They get beat up. It can be a bit of a baptism by fire, which is all right, because I won't say it's all right. Certain aspects of it are okay. Other aspects of it aren't. But the thing is, once that occurs, then you, like you said, you realize that, wait a minute, I'm spending 50 to 60% of my time with the EMR and maybe 20% with the patients. And that's part of that rude awakening. How am I going to manage that? How am I going to adapt to it? I'm saying that doesn't have to be the case, but that certainly is the reality for a lot of folks when they first come out. And that is another reason why in academic, if you will, universities or institutions, if you will, there can be a high turnover rate.
Yeah.
If you can get through that first 3 years, if you can kind of adapt a bit and get through that, because you find your legs underneath you, and then you're able to kind of get a bit more balance and see your sense of purpose at that institution, as opposed to feeling like a cog.
Yeah, no, that makes a lot of sense, because I think that depending on how long your residency is, you have to do the tough work, and you're the one on call, and then you're the one that's doing all like the medical janitor work, the medical janitor work is what I call it. But the person doing charting, you're the like calling your attendings, etc. But then once you get into academia and you're in attending for the first like 3 to 5 years, I think that you run a huge risk of like getting kind of scared. Like, this isn't for me.
Yeah, I think when I think about my first 3 years here at GW, the first thing I reflect on, people said, wow, Lorenzo, you did a great job the first year. I'm like, great, because I don't remember any of it, because my daughter, Taylor, had just been born. So I'm like, awesome, great. I'm glad you guys felt that way. The second thing that I thought was that just being scared out of my mind, because you're put in this situation where you're also teaching residents. So I remember when Griff, our chairman, he's like, all right, I want you to give the psychosomatic medicine lectures. And I would madly like be always scrambling. I would just like, oh,
is this enough? Did I look at the right thing?
Yeah, did I look at the right thing? And I was just always terrified. Like, the residents are going to reveal me as like fraudulent.
They're going to see through you. Like, you're not a doctor.
Oh, but I'll tell you, there is nothing more gut-wrenchingly painful, in my opinion, than having a group of medical students and residents look at you and just basically they have that look in their eye like, dude, you don't know what the hell you are talking about. That is motivating. I'll give you
2 stars on Yelp. 2-star lecture there, Dr. Norris.
Yeah, no, yeah, you want feedback, you will get instantaneous feedback.
That's awesome.
But that fear, that trepidation a bit when you first start, yeah, that's real. But I'm going to tell you something that actually helps with that a big deal is the people that are surrounding you in your department. If you've got mentorship, and I'm gonna give a shout out to the people that like helped me throughout the year. The biggest thing I found, seniors who weren't afraid to admit mistakes. Like, you know what, I did that too. Yeah, Lorenzo, I bundled that was a snafu. I did the same thing. Let me tell you what you need to do. Because then that sense of community, man, that was everything, man. It still is.
Yeah, I think that it was a conversation that we had with Dr. Daisy Smith of the American College of Physicians, and she's sort of the flag carrier against physician burnout. And what she said, and something that I've noticed, is that the way that physicians are portrayed in popular culture, TV, is juxtaposed with how it is in real life. It kind of dehumanizes. So you feel like if you make a mistake, you are the only physician that's ever made a mistake, because they're all hidden. So I would, building off of what you just said, I would be under the impression that hearing someone who's 20 years your senior say, yeah, I did that same thing too, I did it last week, it happens to all of us.
That's, to me, the biggest thing wherever you talk about when you're going to those different levels, whether you're going from residency to whether you're going to being an attending, it's feeling comfortable and safe to make a mistake. And in medicine, because we're dealing with people's lives, we really hold ourselves so accountable. And one of the things that I had to learn is this idea of be tough on the behavior, but easier on the person. Because I almost guarantee you, I don't care what rank your doctor is or where they finish in their class, like almost 99 times out of 100, the person who's going to be the hardest on them is them. You don't even have to add anything to it. They are like eviscerating themselves because they don't want to make mistakes. But one of the things that we have to learn in medicine is to feel comfortable with actually admitting that I made a mistake or I don't know. And if I'm being real honest, it probably took me, it's an ongoing process, but I would say maybe at the end of that 2 to 3 year period after being and attending, those first 2 or 3 years where I felt comfortable telling or saying out loud, you know what, that was a mistake. Even if I was saying it to residents or medical students and just kind of owning it because it was important for me and hopefully it's important for them. Yeah,
and I think I always like to use sports metaphors because in my opinion, sports are they're like microcosms of life. There's nothing I can't make a metaphor out of sports with.
All right.
You give me a challenge, I'll figure it out. But my metaphor that I tell my friends is like, if you made a mistake, you're going to make that mistake again. And the first thing you got to do is sit down and watch film. You got to be like, well, this is where I screwed up.
Yeah.
If I had done this differently here, and next time I got to see the defense and I got to do something different. I got to make a different decision with the ball. I gotta make a different call here. But if you don't do that, the first step of that is to watch the film and say, I made a mistake. That's me.
Right.
And if you don't do that, then you kind of bury it and it becomes something that you're holding on to. Like, I made a mistake. No one knows.
Right.
And that's when you get, I think that leads to burnout. That leads to, I mean, you're the psychiatrist, but I would imagine that leads to some anger and some fear and some despair.
Well, if you make a mistake and you hide it, or if you start to feel a sense of shame with it, that can certainly lead to this idea that you were ineffective. That can certainly lead to this idea that you might start to isolate. And then consequently, it also might start to creep into the idea of whether or not you can act in an autonomous fashion or whatnot. So I certainly think that, I can actually make it even a little bit more straight to the point.
Let's do that.
All right. You spend all that emotional energy hiding something, you're going to get emotionally exhausted. That's one of the key factors of burnout. You don't got time to spend a whole bunch of time like burying something, because that has an emotional cost to it. And that eventually is going to come back to bite you in the butt.
Yeah, I mean, that makes a lot of sense. So something that I've been trying to delve into and what we're doing here at Frontline is looking into work-life balance, physician wellness, and things that outside of your specialty, outside of medicine and what you like. And you and I, when we first met, probably about a month and a half, almost 2 months ago.
Yeah, before the Cavs lost. Yeah,
that's right. Yeah, we sat up there and we chopped it up pretty good about basketball, the NBA. I think it was second round of the playoffs.
Second round, something like
somewhere
that.
in there.
Yeah,
and then we talked about rap and hip hop as well. And it's so interesting because the more I get into personal relationships with physicians of all specialties and even nurse practitioners and nurses, I realize that like there's white coat and scrubs is day job, but there's a lot to talk about. So you and I remember having a really interesting conversation with you about how you thought that there was a way to study rap and hip hop as an avenue through which to explore mental health and mental illness.
Absolutely.
That blows my mind. And I thought about that. That makes a lot of sense because those guys are and gals they're the 21st century version of classical poets.
Yes.
With like the European poets and Walt Whitman and Edgar Allan Poe kind of called everybody out a little bit.
Right.
And that's what's happening now. And I think that what we agreed on, in my opinion, the two dynamic, transcendent storytellers that use rap as storytelling, Eminem and Kendrick Lamar.
Absolutely.
And Kendrick just won the Pulitzer Prize.
Kendrick should.
Yeah.
Kendrick Lamar, I personally have not seen in recent memory, in terms of hip hop, an album that had that seismic of effect on the youth culture. When I talk with folks about Kendrick Lamar, when you talk with youth or even just Kendrick Lamar fans, his is one of the only albums that everyone is like, you have to listen to it 8 to 10 times before you actually understand it. Forward and reverse, because it actually, people would argue that it tells a different story. But what Kendrick is getting at in terms of, he's getting at so many different themes in terms of heritage, in terms of, he touches on spirituality, he touches on our conflicting roles as like African Americans in this country. I mean, you name it, he does it.
Right.
And that is, again, and he's not actually, when you listen to, if you will, Damn, he's not, for people who kind of know hip hop, he's not actually producing bangers. He's not producing like club or like something
it's
that
not
you're
something
gonna,
that you would listen to. It's something that you would listen to kind of by yourself to reflect a little bit.
Exactly.
Yeah.
And the fact that he can make something like that causes people to reflect that much. Mm-hmm. All right. Because I always think about DNA, that I got royalty and dun inside my DNA, because then you're getting at exactly kind of how particularly African Americans or people or anyone for that matter can feel or understand themselves despite what you may perceive somebody putting on you. But so it's very complex. But the other person, Eminem, he brought a voice to an entire population. When we talk about that rural population, when we talk about a bit of that, if you will, forgotten group of folks. And you want to know the beautiful thing I thought about Eminem and Kendrick Lamar as we're talking about it? You may superficially say, all right, Kendrick Lamar, African-American, Eminem, white, or this, that, or the other, but the pain is the same.
Yeah.
That was the thing. The pain was the same. And the thing about Eminem, he was absolutely, I won't say one of the first artists to talk about mental health or depression or suicide, because there were actually people from before that who did it, but they just wouldn't have been as large as Eminem. But Eminem,
he really made it mainstream.
Absolutely.
Yeah, I think that he, as far as in your art form, I know that movies had been doing it for a while, but he was the first person. I feel like he was the first person to be like, man, I'm not well. I need some help or something. He struggled with addiction and some other stuff. The song, there's a really famous song, and most listeners will have heard it, or will have someone who have heard the duet he did with Rihanna, which is about domestic abuse.
Absolutely.
And you're like, wow, this is someone who, not Eminem, but the character in the song is someone who it's a slippery slope, and all of a sudden they were in this relationship, and now they're violent with each other, and you're like, that's a story for millions of people.
Right. And Eminem might have been. I wouldn't say he's the. I'm not going to actually go out on a ledge and say that he was the first person to do that, but for a broader mainstream, for him to own it the way that he did, and for him to do it and personalize it, that was huge. And I mean, I want to be careful in case for some other reason, like you got KRS-One or one of the legendary luminaries of hip hop, and it'd be like, no, Norris, let me tell you. So I'm realizing people have been doing this, but again, for popular culture and what they see, he was one of the first. But going back to what we were, just to bring it back up, we have manualized like CBT, therapy for depression, things of that nature. I would argue that you can take the work of artists, and those can be separate chapters. And if you really delve into what it means and operationalize it, operationalize it is a strong word, but that is just as valid of a way of working with a patient as anything else. I can't tell you how many patients, particularly young adults, have told me about the influence of hip hop in their life. And that's also me speaking personally from me growing up in a little suburb outside of Cleveland, Ohio called Euclid, when hip hop, kind of the golden age of hip hop, first kind of exploded.
Yeah. So, I mean, I know that obviously Chicago, but then Detroit and Northern Ohio, the scene for them, I think it was like mid 80s. It really started to pop up in Ohio and Michigan, and Detroit did a really good job. Obviously, Eminem was I think like the apex of that in the 90s or whatever, but there was underground as it transitioned from like Motown and like blues, and then you started to put the spoken word with it. And it's really interesting to say that, because so for intellectuals who are interested in communities and the juxtaposition between money and poverty and white and black and old issues, I feel as if The Wire, the TV show The Wire, is the one that gets it. But for young people, I've noticed that they'll say, like, if you want to know how I feel, there's music that will explain how I feel. Like, I can't quite verbalize it, but this CD, this song, these tracks right here, this is what I feel.
You know, it's interesting you brought that up, because and I'm not going to say his stage name correctly. I want to say Extinction.
It was gang violence, I think.
He was gang violence. Yeah. I'm not positive about the full details of it, but my cousin and my daughter, you know, were listening to him, and he had a very reasonable following, and his death shook a lot of people. And going back to what you said, when I listen, like my daughter, sometimes when she's talking to me or whatever, she wants to talk about hip hop. She's like, listen, Dad, what do you think of this? What do you think of this track?
How old
what
is
do you
she?
think? She's 12.
Oh.
Yeah.
All right.
So
that's when I got into rap.
Yeah. So she wants to know what I think of this. Like my cousin, or not my cousin, my nephew, Connor, as a matter of fact, he's always like, you know, Uncle Lolo, listen, I want you to listen to this. Tell me what you think about this. How about this? How does this compare to that? So what you said, Nick, that's on point, man. I mean, we communicate through a lot of different ways, but if you a way to start to understand what the youth are going through is to listen to hip hop. And I was the same way. I listened to, I still remember many different things. Listening to NWA, a lot of folks, Tribe Called Quest, some of my personal favorites. But if you wanted to understand kind of a little bit where I was at, because around late 80s, early 90s, that's when that Black consciousness movement was really taking fold with Public Enemy and stuff. So I'm with you on that.
Yeah, I think that obviously art can do a lot to expose some of those issues, but what else is really interesting with the murder of Extinction? I believe it was a murder. Yeah. And recently we had 2 celebrity suicides, which makes me think that, and obviously you say this all the time, there are tortured artists and it's this and that, but also like it is depression, in my opinion, and suicide is an implosion at the most basic level of humanity. It's a tragedy on the inside.
And Nick, we were talking about this, but I actually want to hear a little bit from you, man. Anthony Bourdain, I'm kind of torn up over that.
Yeah,
I'm really.
I loved him a lot for a couple of reasons. The first reason I really loved him is because he was the first guy on the Travel Channel. There are always originals, and now TV shows, and because I'm a media guy, they will pick up something that works and they'll just do it until everybody hates it.
Yeah.
But he was the first person that it was original and it was cool, and he would go to like Taiwan, or he would go to like Mississippi. So I went to college in Mississippi, and his Mississippi show was That's What It's Like. And when I moved to Philadelphia, his Philly show was That's What It's Like. That's how he captured the essence of the town and compared that with obviously food, as he was an award-winning chef. And his storytelling it was quite remarkable. But now you look back and you see his face the dark circles around his eyes, and he had struggled with addiction for decades. And you look, man, he was sad and in pain for a long time.
You know, with the loss of Anthony Bourdain, first off, the loss of anybody to suicide is tragic. But that one, I really, and my thoughts and prayers to Kate Spade and all of her family and friends also, absolutely.
She influenced everyone's life. Kate Spade bags
influenced everybody, everywhere. You can't go anywhere without seeing Kate Spade. But when I thought about Anthony Bourdain, for me personally, that was like losing a friend.
Yeah. I mean,
every Sunday, like my wife and I, we would sit down and we would watch, Parts Unknown, and we would have discussions about it. And Anthony Bourdain, he would make me think. He would make me, and I've shared with you, I mean, I took inspiration in terms of like, if I could do something in form of storytelling or media, I wanted to look a bit like that, because he took what he mastered in terms of food and then he applied it to so much. But then going back to what you said, I mean, and I guess my own response just being, I started to look, because long-term people who looked at the show will know, and I'm blanking on some of the seasons. There were seasons where Anthony looked a bit, my wife and I would comment on that, like, this is a bit of a darker season. Yeah. This is a bit of a man, at times it felt like he was coming to terms with certain things. Whereas at times in earlier seasons, like, you were like, it was like you were going on Anthony and you were having a party. Yeah. You were just like, all right, how much are we going to drink? What are we going to eat? Right. How are we going to understand this culture and this society? But when you looked at it, again, that I would be curious. I think that people, because you want to know why I'm saying that, and I'm in no way, shape, or form diagnosing Anthony Bourdain or anything of that nature. But what I am saying is that I felt as though through his art and his storytelling, he also reflected who he was and his emotions. And that's what I felt. And at times when I would look at it, because it was good, it was always good, but at times you could feel the emotional tone of its shift from season to season. And I actually thought in recent seasons, he had started to have a bit more it was a bit more back to some of the original seasons with a little bit more lightness to it, for lack of a better word.
Yeah, I think that's a good way to look at it. My favorite literature quote about what good storytelling actually is was by Ernest Hemingway, and he said that writing is easy. I'm going to transpose that to storytelling now. But writing is easy. All you do is sit at the typewriter and bleed.
Yes.
Right. And so you see like people like Anthony Bourdain, and I mean, I can't possibly assume what was going through his head, but in the years leading up to this tragedy, but you know that factually, I mean, the struggle with addiction before he got famous.
Yes, which he was very open about.
Yeah, definitely, which I think was a big positive step forward. Anytime a celebrity openly admits that and says like it's not sexy, it's not what you see on TV, like I'm a drug addict. No, it's actually really hard.
I remember the episode, and I don't know where he was visiting. It might have, I don't want to say it was Pennsylvania, I'm not sure, but he visited a town or a city that was struggling with drug addiction. And that was the first time I learned that Anthony, he himself struggled with heroin addiction. I mean, I'm sure like people who have followed his journey, I know that he was very open about it in Kitchen Confidential. I had never read Kitchen Confidential. But when he revealed that and talked about it, I personally found that very powerfully moving, that he would choose to do that. And I mean, I want to stay on this topic of Anthony Bourdain, but I just want to actually, in terms of like great art or people, that seems now, if I'm thinking about Anthony Bourdain or Eminem or other people, and even what you just said about Ernest Hemingway, that willingness to just bleed in front of others and show who you are. And that also flips back to medicine and being willing.
You stole my transition, man.
Yeah, I know. It's our willingness to actually show that, we hurt too. We bleed. We make mistakes.
Well, I think there are a couple of times in this world. So my background in media is in sports media, if you can't tell.
Yeah.
And I jumped ship because for two reasons. The first reason was that I got really discouraged with the lack of humanity that was in it. And what I mean by that is that I could report a sports story and it's really irrelevant. And then I watch TV and I'm like, I got these people arguing about who's going to win a game, and I'm like, man, I know who's going to win the game because I'm going to watch the game, and then it's going to be over. I can't wake up in the morning and pick a fake fight. I want to do something that has a little bit more potency to it. That's going to do something. So I looked to do work in either technology, business, or medicine. Philly called first, so here I am.
Okay.
And now, as I'm getting into it and becoming more educated, I bought a bunch of Audible courses. I read books by doctors all the time. And what I'm learning is that there are a couple times when you can see there's just like an immense sadness and just a lot of weight, and there's tiredness and burnout. But the light comes back on when you start talking about patients and science.
Yes.
And I remember, I'll never forget my first interview. He was an oncologist, and he was in France.
Okay.
And I needed to wake up at 3 a.m. to talk to this guy. He's like, this is the hour I got. You can't talk to me for another month. I said, well, I took the job. I got to do the job.
Okay.
So, and I prepared really hard. I read like front to back a bunch of papers by this dude in the New England Journal of Medicine. I was scared I was not going to do a good job. And so I started asking really intelligent questions to give myself a little credit.
All right.
I heard him go from like, I became something that he had to do, and I turned into something that he wanted to talk about.
All right.
So it was about bladder cancer, and we started talking about like urine test assays, and like people in the country are going to be able to send in urine samples, and we'll be able to tell them if like he just got really excited. I thought he didn't want to talk to just another person. He wanted to talk about his thing.
Yeah.
Once it became about his patients and about moving forward, and I go to meetings and I see these practitioners from Middle America, and they're coming, and they're just so excited that they're going to be able to go home and tell their patients, well, there's this new thing, and we're going to try this thing this time, and I'm really excited to do that. Because it is like an art. It's the real world of EHRs and coding and money that makes you sad. Once they get back into, once you people, you magicians, once you get back into what you want to do, it's really energizing.
Well, hell yes. When you said that, what it made me think about is what people really get out of medicine and what the rewards are. And it's in my humble opinion, it sure isn't the money. There are a lot easier ways to make money. It's people, by that point in time, most physicians have had some form of recognition or prestige, some type of way. It's the patients, the point blank, it's working with patients. Like the best thing, and I would pull it out and show it to you, but I won't because I don't want to break patient confidentiality. The best thing that I've been a part of is working with a patient for 4 to 5 years, and that person sending me pictures of their family.
Yeah.
That to me, that is, and I mean, even though I just said it right now, and probably every physician in the country, well, I won't say every, but most can, whether pathologist, radiologist, or something like that, they can tell you a similar story in terms of how meaningful that was to be a part of somebody's life and to be of assistance and support at that time of need. But once you remove that, and then if medicine turns into a business, if medicine just strictly becomes another consumable good, well, then then you're going to start to question it. Then you're just kind of like, well, you know what? If I'm selling something, or if I'm just doing just strictly a customer service type of thing, then why did I even get into this? Right. Why did I take an oath?
It reminds me a lot of like storm chasers, or you see first responders at like 9/11 or the Boston Marathon bombing. The first responders are running into the fire, and I think a lot of I think that same way of physicians. Like you're very much the like soldiers in a way. Like I'm going to go toward the problem. I'm going to try to fix the problem. But when you are kind of taken away from that, and it just becomes an entity, like you're an asset. Yeah, I feel like that's when burnout and physician suicide and all of these problems really become like a flare signal. Where you think I think the data show, and I'm not 100% on the most recent updates, but the highest risk for physician suicide is like late residency and like the first 10 years out. And I would imagine
I don't want to quote the data on that because it definitely changes, but I would say that what we know about physician suicide is that it is as we all know, it's at an alarmingly, it's epidemic. There's no need to say it's at an alarmingly high rate. It's epidemic. Physicians, roughly about one physician dies by suicide every day. That's 2 to 3 times the general population.
Being a doctor should not be a risk factor.
Exactly. That's it. We could just stop the podcast on that. Being a doctor should not be a risk factor for dying by suicide. I mean, being a fireman should not be a risk factor for your house being on fire.
Yeah.
I mean, and when we actually take a step back to think about that, we got to kind of say, like, what the hell is going on?
Yeah.
But then again, it goes back to that original thing. How do we as physicians admit, not just when we make a patient error, but when, I think you started this, one of the things of the post-call podcast is life balance. When do we say, like, you know what, like, buddy, or if it's your fellow colleague, Nick, my life's out of balance, man. I need some, I need to do something.
There was just I believe he's a trauma surgeon at Jefferson, and he's a vet. He's been doing it a while, and he just self-admitted himself, like recently, like a month ago, a couple weeks ago, and like that's the kind of behavior and like that needs to be praised. And in my opinion, we're like, dude, you made the right call. No question about it.
Yeah. I was at a meeting. I don't know whether it was. It might have been. I don't think it was an APA meeting. It might have been a group on student affairs meeting. It was a meeting, but it was a meeting on wellness that was precepted by Dr. Worley, who I actually did a podcast with, and I'm blanking on the gentleman's name, and I won't say his name. I was so impressed with. He was a member of the audience. I was so impressed that he said that he actually stepped away from like $1 million grant.
Yeah.
Because it wasn't the right time or place for him to do it based off of where he is. And to this day, I am blown away that he did that, because anybody who knows anything about the world of academia and scholarship,
money.
You do not step away from like $1 million grant. You just don't do it. But the fact that this person who clearly, knew his science, knew what was going on, was just like, no, it's not. And more examples of that, I think, can certainly only help.
Yeah, I think so too. I think the feeling of isolation, and I don't think this is. I mean, you know more than I do, obviously, but I don't think this is for physicians alone. The isolation and the impending doom and the despair is something that physicians are feeling, and I think that's probably in line with what the general population feels. It just happens at a higher rate. But that isolation is really scary to me, and I think that it happens in residency. When my resident friends are telling me, like, I don't want to admit I made a mistake, that we're competing with each other. Like, I can't be this person.
Right. Well, that's an interesting thing. I think that what's happening with physicians is just not. I think it's a reflection of what's going on in society. I mean, the CDC came out recently with the fact that suicide rates are increasing. Our former APA president, I think I'm going to say her name incorrectly, Dr. Oquendo. I probably said her name correctly, but I remember reading something where she said, which is correct. Unfortunately, we've known this now for a while. It's been going up. So if you think about it, we've got suicide rates increasing across the country. We're dealing with the opiate epidemic. We've got a workforce that's supposed to support patients where we're dying and burning out at an increased rate. So we've got to start to ask some really hard questions. And just to go along with what you just said also, I was recently with a work group that was formed by, if you will, or this group called Documental. Whitney McKnight founded Documental. But this group, they came together and it was a group of deans in the DC area, law school deans, undergraduate deans, medical school deans, with the sole purpose of talking about this universal problem of depression, burnout, suicide. But here's the other thing. Difficulty seeing purpose in what they're doing and what it means for us as deans and higher educators to graduate people that are burnt out, that may not have a good idea of what they're doing. And what are the commonalities across law, medicine, grad schools? I thought the meeting was great because you're starting to see that, wait a minute, there are a lot of common things that are going on, but there's also things that I can take from my colleagues in other settings and say, wait a minute, hold it. Maybe they're doing something a little bit different that I can take. And I think ultimately that's going to be part of the solution for medicine as well as other areas, us not being siloed into our own different areas.
Yeah, I agree. And there's so many examples of that throughout history in science. Like Mendel discovered the gene and it wasn't practically applied for like 40 years. It's been in a journal somewhere that nobody knew about. Like ether, there's a dentist in Georgia that's been using ether for like 15 years, and then it got discovered later. Like,
Yeah.
if you just pay attention to what's going on, and that's in medicine. Once you start crossing over, this is not the only place where this is a problem. Like, Wall Street has a huge drug problem.
Absolutely.
And like they're starting to talk about it, and in sports, there's a huge opioid addiction issue, and they're on the forefront of like maybe we should start to use marijuana instead. And but isolating industries is where you start to get tunnel vision. Like, you are this thing, and when you start to become like this in medical writing, as you know, you don't like to say a blank patient, you say a patient with blank.
Yes.
So that they are not synonymous.
Yes.
Like, I don't want to be synonymous with what I do. I choose to do that. That's not who I am. Which is sort of, I think, why the purpose of the post-call podcast. Like, when you're post-call and you're tired, like, what are you binging on TV before you go to sleep? That kind of stuff. Like, who are you? You chose to practice medicine. You chose to go to medical school. That's your cross to bear. But you are not that.
Yes.
That's just your choice.
Yeah.
And like separating those two things, like, I can be friends with artists and I can be friends with lawyers, and I have opinions about stuff like Kendrick Lamar and LeBron James and all of this stuff. That's important, but I don't think there's nearly enough of that.
No, there's not. There's not. And again, I like what you said, that this is something that I do. And yes, it's part of my purpose. But once these type of things just strictly define you and you isolate, going back to that, when you isolate, that is when problems are going to, you're not going to, when we isolate, we take away so many solutions. Like, as you were talking, I mean, I don't know why it popped into my head, but I was like, he's absolutely right. I mean, part of the solution that we might be looking for or whatnot probably already exists. For all I know, like, I just ran like a farming community in Iowa might have it, and I have no idea. But because I'm stuck in my little, I won't just say, my routine, my thing. Like, I won't talk to somebody in media. I won't talk to someone in journalism. I won't figure out like what my I was like, I won't look at like how an Uber driver copes or what. Take your pick.
Yeah.
You know, I have a set view of what it means to either be resilient or strong or this, that, or the other, and I let that view kind of determine what my solutions can be, and that's completely the wrong approach. So yeah, you get stuck.
I'm one of the nerds who subscribes to David Foster Wallace's life. And I don't know about Dave, but there's an example of an artist suicide. And that guy, he was, all of his books and his writing and his interviews, he was basically screaming for help. And he gained tolerance to antidepressants. And then after that, they just like, it was inevitable, apparently. But he has a graduation speech from Kenyon College in 2005. And if anybody hasn't listened to it, if you're ever having a tough day, I would recommend listening to this. It is life-changing. I recommend it to everybody, and most people that listen to it say, like, it happens for me, like, once a month I listen to it. It's called This Is Water. Okay. And what the purpose of the speech is him saying, like, you may have an education if you have a liberal arts education, if you're a physician. Your education did not teach you how to think. You ever hear, like, I went to college, learned how to think. It's not what it taught you is what to think about. So like at the end of your day in the story is like, you can choose to be mad at the person who cut you off in traffic, or you can think, what are they going through today? And that sort of empathy, I think, relaxes people. But in America, my hypothesis about all the public displays of violence that we have, for me, it's people that are like, I was just clenching my fist for so many years, I didn't know what to do. And as a result of that, they freaked out. And that can either be suicide, or it can be domestic abuse, or it could be some sort of random act of violence. And obviously, the Second Amendment enables people to have firearms, which makes that even scarier.
What made you kind of come to that? Just out of curiosity.
This is water.
This is what, okay.
Yeah, so for public violence, because I know... I played hockey, so I hung out with a lot of Canadians, right? And they were always like, "Why are you guys so mad all the time?" Oh, that's a good question.
That is a good question.
Like, you look like there's a rat race. And when I was in college, when I gave up sports media, I had a foot in the door, and I had done some things for ESPN on TV, and I burned bridges by doing that. And I thought, like, why am I in this race? Like, who cares? Why am I trying to get to the top? Why am I comparing myself to other people? And I think it was, give credit where credit is due, and I could be wrong, but I'm pretty sure it was the late president of the Mormon Church who said, comparison is the thief of joy. Comparing what you've done to other people, and everyone's like, that person, they live this life on Instagram, and I need to look that good, and I can drink mint juleps and go to the Kentucky Derby, and I can do that. But by this being in this rat race, if you feel like you're falling behind, I think people will start catching their fists.
Say that quote again.
Comparison is the thief of joy.
You know, I've heard, and I think Steve Covey, 7 Habits of Highly Successful People. I want to say that he has a podcast, not a podcast or a YouTube, and I don't necessarily know that he coined this or whatever, but when you talk about comparison, I want to say that that was one of his 6 or 7 emotional cancers. And I'm just reflecting on what you said in terms of comparison leading to, if you will, bitterness, anger, things of that nature. And then you actually think about where we're at right now, where we're constantly bloody. You're constantly being compared almost. It's kind of ridiculous.
Yeah, it really is. And like, I feel as if everything is a competition, and I'm a big fan of competition under the right circumstances. That's how there's success. But the main competition has to be with oneself.
Yes.
And the other thing that you have to understand, and this is a difficult thing for people who, depending on how your personality is and like the endorphins interact in your brain. I've done a lot of research into this.
Yeah. Okay.
Your reward system is really important, and I struggled in school because my reward system was not finishing. I didn't really care about, like, when I played sports or when I would do a paper, I didn't care about winning the game. I was always bummed when the game ended. I was like, I just kind of wanted to keep going. But if you keep rewarding yourself psychologically with the end result, and this is addressed in This Is Water, you got to listen to that speech, where you're like, you'll feel emptiness because it'll never be enough. I mean, there's only one Mount Everest. There's not a taller one. Like, what are you going to do now? If you enjoyed the activity of doing it, that's when you feel pleasure. It was William Faulkner who said, don't be a writer, be writing. I was at a party in college once. Yeah.
Oh yeah. Yeah, you can. Oh, we can do some mileage with that, man.
Yeah.
Yeah, sorry, I didn't even mean to.
No, it's fine.
It started to make me think about also the difference between Eastern and Western philosophies.
Definitely.
Yeah, that's what it. No, keep on going. Keep talking.
Yeah, so
man.
I was at a party one time, and we met this girl's boyfriend, and me and my friend he goes, we were like, what do you do? And he's like, well, I just want to be a soccer player. And I was like, all right, whatever. And then like later that night, I was like, well, what the hell does that mean? I could go buy cleats at Dixon. I'm a soccer player. But what you should say is like, I just want to play soccer, which is a different thing. Like the action. Like I quit sports media because I didn't like it. Right. I like this conversation with you, and this is what I want to do. And I don't care about like if 50 million people listen to it, that's dope, and I'll get money. That's awesome. But if no one does, I like doing it.
Okay. That you were saying what Faulkner said. Don't be a writer.
Be writing.
Be writing. This is, and I'm gonna something with, and I may have told you the story before, but it had a profound impact on me. I was working with a patient, as a resident, patient with severe mental illness, and the patient was talking to me, and all of a sudden, he started talking to me about healers and that the healers are everywhere, and I got a bit curious, and I'm like, what are you? I'm trying to think, is he delusional or something of that nature? And he's like, look, what are you talking about in regards to these healers being everywhere, this, that, or the other? He said, listen, Dr. Norris, the healers are present, but you're going to have a very difficult time seeing them. And I'm like, why is that? Because they heal and then they keep on moving on to do what they're supposed to do. And that, whether it came from somebody whose cognition was a bit off, but what it stuck with me was this idea of healing and being a healer and healing as opposed to being stuck in one thing or another. And it maybe goes back a little bit to what you're saying. Doctors, to me, I can't speak for others, I'm at my best when I feel as though I am helping others heal, or I'm a healer, or I'm working in a healing community or paradigm.
Yeah, you don't want to be a doctor. You want to be practicing.
I want to be practicing. I don't want to be, I don't want to be, like, again, I think writing is more important than being a writer. Healing is more important than knocking off all the checklists of quote unquote doctor. And I think that inherently, for me, I can't speak for other physicians, is something that has drawn us to the field.
I think it takes great inner knowledge, and I would encourage physicians who are in this position, because just as a personal experience of like, you're on a track and you deem success this one way, that's great. But if there's an inner voice when you're like, man, I don't know, I kind of want to take a pivot here and do something kind of weird, do it.
Do it.
Do what you want to do.
Do it.
You know what I mean?
Do it. We've been talking about a lot of things that have interwoven art, burnout, and one thing, when I think about burnout as well as resilience and some of the stuff that we've been talking about, as well as isolation, is that, and again, with that maybe Western versus Eastern philosophy, I think sometimes in our society, and by that I mean our typical American kind of Western society, we kind of view resilience, individual resilience, and we don't pay enough attention to what it means for a community or society to exhibit that societal or community resilience, in terms of sustainability as well as growth. So when you were talking about that, I think it's not only about writing, but it's also at times about feeling as though you have others with you who enjoy the act of writing for no other reason than that. We're not competing. We're not, unless we're competing in the right frame.
Right.
But to me, good competition, you're competing for growth.
Yes.
And you're both like, how did I grow? How did I grow at the end of it? Not to actually put the other person down or compare, because it's completely meaningless.
Right.
So when I think about that, though, in terms of community resilience and what we were talking about, or what you were talking about, in terms of that writing or that enjoying the process, that's being around other people who genuinely enjoy the process. Yeah. And what happens to people when you're not around those folks? Like maybe you do enjoy the process, but you're in an environment where that is not validated or lifted up.
Right. Yeah, definitely. I when I was in Mississippi and I was doing ESPN stuff, I would get asked by parents, like, what does my kid need to do to be a football player or whatever? And I would say, listen, if they enjoy playing on Friday nights, that's great, because everybody likes that, because it's awesome. If they like practice, that's what you want to do.
Yeah.
Because if you enjoy the day in, day out stuff when there's no one there, that's what you want to do. Like I get so much joy watching the two sports I've noticed. Like basketball, sometimes not as much. Not like 5-on-5 NBA basketball, but like maybe some like skills competitions. But in baseball and hockey, I watch the look on some of these guys' faces, and I'm like, yeah, Miguel Cabrera is making $300 million, but he would do this if he were making $50,000.
Thank you. Like that's that, and kind of my thoughts in regards to that. Medical students will frequently ask me, because in my role as a dean, like they're thinking about their career and what they should go into. And if you will, as you were talking about, do they enjoy the practice? The thing that I always ask them is, first off, do you understand what this profession is? Which is very difficult, regardless of what you're going into, because you haven't really done it. But you can still try. But do you actually do you like the grind? Do you really not appreciate and respect it in a way that supersedes your emotion? It goes back to what you were just saying. Would you be doing this if nobody was paying you? Like, that's kind of how I knew I was going to go into psychiatry, because I just kept doing it. It wouldn't, it's kind of, I shouldn't say that because my department might stop paying me, but it's something that you are drawn to do and you keep on doing. But if you appreciate the grind of it and you find purpose in that, I think that that's a big thing. And conversely, when people are not allowed to appreciate that and to like appreciate the process of that struggle, all right, and that grind, whether it be taken away due to administration, EMR, what have you, again, that starts to chip into your sense of purpose. Yeah,
it really does. And I think on one of the first editions of the Psychcast that featured Dr. RK, and Dr. RK is Renee Kahansky, and she's got a practice in Connecticut. Yeah. She just gives a pearl at the end of the Psychcast episode. It's a good way to like wrap it up, and her pearls always end with like, keep practicing, you can do it. And one of her ones just made me really sad. It said, set a goal of trying to spend 20% of your work working with patients. And I was like, it should probably be the other way around. Wouldn't you rather be 80%? So I think a mission, a collective good place to start with regard to burnout and physician wellness and what your life is like post-college. Like, let's get that percentage up. Let's work on that.
I personally think that is a very, 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 very correct way to approach it. If you don't, it's because, again, it's going back to what you said. I'm okay with setting high goals. You may not reach them, but it's the process of trying to get there. That's where the meaning and the purpose is. And look, we've been over EMRs as an example, not to paint EMRs as the bad guy or anything like that. EMRs have been great. But the thing is that we're still struggling with how to make use of all of this knowledge. If we actually say that this is what we as a society value, not just doctors, but patients' families, all of us, everybody involved, this is what we value, then I am absolutely convinced that we can construct something that looks more in line with what we think medicine should be practiced, and then that's just going to filter down. But I agree with you. I think we want to set those standards in ways in terms of what it is that we want, not just strictly what we want to accept. Don't get me wrong. I'm fine with the foot in the door kind of approach, but I'm also not afraid to set high standards and shoot for them. And if you don't, that's okay. But enjoy the
No,
process.
I'm definitely with you there. Like, we'll wrap up on this. In my opinion, like, on one hand, this is a daunting task with the epidemic of suicide, heroin usage, diabetes, obesity, some real big problems that are going to cost a lot of people a lot of money, and it's a really intense challenge. On the other hand, I can touch my phone and food shows up at my house, so I'm pretty confident that we can get a lot of things done. You know what I mean?
Nick, I'm with you on that. That kind of puts it in perspective.
Like, we can do just about anything.
We can, if we can get Uber food, we can figure this out.
Think about, like, just not that long ago, humans were like, I hope I have a meal this week, and now, like, I literally touch a piece of glass and it shows up to me.
Well said, man. Let's get it done.
All right, Dr. Norris, it's been really great. Dr. Norris is the editor-in-chief of Current Psychiatry, which is now MDH Psychiatry. He's also the host of the MDH Psychcast, which can be heard every Wednesday morning starting at 4 a.m. Dr. Norris, thanks so much.
Thanks so much.
We'd like to thank Dr. Norris for sitting down with us, and we'd like to thank you for spending part of your day with us. At MDH, we know that physician burnout is at an all-time high. We're here to talk about it. So the next time you've got that burnt out feeling, unlock your screen, put your buds in or turn your speaker on, and join us for a meandering post-call kind of conversation about patients, practice, and whatever else comes to mind. Next week on the Post Call Podcast.
Not being afraid to say no. I think what we've gotten less training on is what do we do when it's discriminatory remarks? What if we do when the patient says, I don't want to be seen by this resident? There was concrete examples of that where the attending said, either we all see you or none of us can see you. And the patient apologized, they moved on. But I think we need training in that.